Everyone, so today we're going to learn about the anatomy of the kidney. Okay, so this is the right kidney, this is the left kidney. Okay, so this is going to be our objectives. We'll look at the position of the kidney anatomically. Where can we find or locate the kidney? Then we'll look at some anterior and posterior relations. Okay, we'll look at structures that are in front and structures that are behind the kidney. And then we'll also look at the covering around the kidney, called the peritoneal covering. Then we'll look at the capsule and internal structures of the kidney. So if you cut the kidney open, what are the structures that you can identify within the kidney? Then we'll look at the renal vessels, we'll look at the renal artery, we'll look at the renal vein, we'll look at the course of the artery, we'll look at the origin, we'll look at the termination, we'll look at the branches. Then we'll look at some anomalies of the kidney. Okay, so for the position of the kidney, okay, the kidney can be found on each side of the vertebral column. Okay, so this is the 11th rib, this is the 11th rib, this is the right kidney, this is the left kidney. Okay, these are the vertebral bones, and what you find here is the intervertebral disc. Okay, so they are on each side of these vertebral bones, okay, or the vertebral column. Now, the kidney, you must know, is a retroperitoneal organ. It's a retroperitoneal organ. So when we say retro comes from the Latin word which means behind or back. Okay, so the peritoneum is just like a covering. So you can equate the peritoneum to an egg. When you crack an egg, you see there's a lining, there's a membrane before you enter the fluid compartment and where you have the yolk. Okay, so that lining, that membranous covering of our abdominal cavity is called the peritoneum, and the kidney is found behind that covering or that peritoneum. So it's retroperitoneal. Now it extends from T12, the last thoracic vertebrae, T12, to the third lumbar vertebrae, L3. Okay, now you can see that the right kidney is slightly lower than the left kidney by about half. Okay, so the right kidney is lower than the left kidney. Again, the kidney can be found on each side of the vertebral column. So one here, one here. This is the right kidney, this is the left kidney. We said that it's a retroperitoneal organ, which means that it is found behind the peritoneum. And we said the peritoneum is a lining, it's a membranous lining which covers the abdominal cavity. So it extends from T12 to L3. Okay, then also the right kidney is slightly lower than the left kidney. Okay, so we will talk about the anterior relations of the kidney, in other words, which structures can be found in front of the kidney. Okay, which structures are related to the kidney anteriorly. Okay, so there are so many structures here, but for the purpose of this lecture, I want you to focus on the ones that I'm about to mention. So this is the right kidney, this is the left kidney. This blue vessel you see here is the vena cava, and then this reddish vessel you see here is the abdominal aorta. Okay, now let's look at the structures that can be found, or structures that are related anteriorly, okay, to the kidney. Now this is the left kidney, so we'll start with the left kidney first. Okay, on the upper medial part, okay, the related structure is the suprarenal gland. Upper lateral, we have the spleen. This area we have the stomach, and then there's an artery here called the splenic artery. Okay, so you can see there are 4 S. Okay, upper medial, the suprarenal gland. Upper lateral, we have the spleen. This area we have the stomach, and then we have the splenic artery. The splenic artery is actually found on the upper border of the body of pancreas. Okay, so this area we have the body of the pancreas. Okay, this is the transverse colon. Okay, it has been cut so that we can see the structures here. Okay, so this is the transverse colon, this is the descending colon. Okay, now when we come to the right kidney, this is the right kidney. Okay, upper medial, we have the right suprarenal gland. Okay, then when you come to the hilum of the right kidney, we can find the second part of the duodenum. Okay, this area we have the right lobe of the liver. This is the right colic flesher, and then this structure here is the small intestine. This is also the small intestine. Now I forgot to add that there's a very important blood vessel here is called the ascending branch. This is blood vessel where my cursor is. It's called the ascending branch of the left colic artery. Ascending branch of the left colic artery. Okay, this is also the ascending branch of the right colic artery. Okay, so again, what are the anterior relations of the kidney? Okay, we'll start with the left, then we'll go to the right. For the left, upper medial, we have the suprarenal, so the left suprarenal gland. Upper lateral, we have the spleen. Here we have the stomach. Then we have the splenic artery here, okay, found on the upper border of the body of the pancreas. This is the transverse colon, this is the descending colon, this is the small intestine, and this is the ascending branch. This structure here, this blood vessel here, this is the ascending branch of the left colic artery. Okay, for the right kidney, okay, upper medial, we have the right suprarenal gland. Then when it comes to the hilum of the right kidney, we have the second part of the duodenum. Then this area, we have the right lobe of the liver. This is the right colic flexure. This is also the small intestine, and then the ascending branch of the right colic artery. So again, this is the left kidney. We'll look at the anterior relations, just an overview. Okay, this is the upper medial, this is the left suprarenal gland, this is the upper lateral, this is the spleen, this is the stomach, and this is the splenic artery, okay, found on the upper border of the body of pancreas. This is the body of the pancreas. This is the transverse colon, this is the descending colon, and here we have the small intestines, and this very important artery here, which is the ascending branch of the left colic artery. Okay, when you come to the hilum, okay, the hilum of the left kidney, we have the renal vein, which is more anterior, the most anterior structure when it comes to the hilum of the kidney. Okay, this is the renal vein, followed by the renal artery. Then the most posterior structure is the renal pelvis, okay, or you can say the pelvis of the ureter, okay, renal pelvis. Okay, again, upper medial. For the left kidney, we have the left suprarenal gland. Upper lateral, we have the spleen. Here we have the stomach. Here we have the splenic artery, the body of the pancreas, transverse colon, descending colon, small intestines, ascending branch of left colic artery. For the hilum, we have the renal vein, the renal artery, and then the pelvis of the ureter. Okay, then for the right kidney, for the anterior relations, okay, for the upper medial, we have the right suprarenal gland. Okay, for the hilum, we have the second part of the duodenum. This part is related to the right lobe of the liver. This is the right colic flexure. This is the small intestine. This is the ascending branch of the right colic artery. Okay, so as you can see here, this is the renal artery, renal vein, and we said this is the pelvis of the ureter. Okay, the most anterior is the renal artery, followed by the the most anterior is the renal vein, followed by the renal artery, and then the most posterior is the pelvis, the renal pelvis, or the pelvis of the ureter. Okay, so the bare areas, we said that they are peritoneal covering, okay, around the anterior aspects of the kidney. They are peritoneal coverings. However, there are three areas, okay, for the left kidney and the right kidney where there are no peritoneal coverings. Okay, so that's what we refer to as the bare areas. So the bare areas are simply the areas without peritoneal covering. So we'll start with the left kidney. Okay, so for the left kidney, the left suprarenal gland, okay, that part has no peritoneal covering. Then we have the body of the pancreas. That aspect or that part has no peritoneal covering. Then we come to the descending colon. It has no peritoneal covering. So three of them: left suprarenal gland, body of the pancreas, descending colon. For the left, it has no peritoneal covering. When it comes to the right kidney, right suprarenal gland has no peritoneal covering. Then we have the descending part of the duodenum. This part has no peritoneal covering. Then the right colic flexure too has no peritoneal covering. Again, say that the anterior aspect of the kidney has peritoneal coverings. However, there are areas where there are no peritoneal covering. For the left kidney, left suprarenal gland has no peritoneal covering. The body of the pancreas of the left kidney has no peritoneal covering. Then the descending colon has no peritoneal covering. When we come to the right the right suprarenal gland has no peritoneal covering. Then the duodenum, the descending part of the duodenum, has no peritoneal covering. Then the right colic flexure too has no peritoneal covering. We will look at the posterior relations, okay, of the kidney. We've already looked at the anterior relations of the kidney. We've looked at the anterior relations. We've looked at the left kidney. We've looked at the right kidney. Now let's look at the posterior relations. We also look at the left kidney and the right kidney. Now for the posterior relations of the kidney, okay, it's related to four muscles. Four muscles. One above and then three below. So one above, okay, and then three muscles below. 1, 2, 3. Okay, so let's look at the one above. This is the diaphragm. This is the diaphragm. And you see, because the right kidney is slightly lower than the left kidney, the diaphragm separates the kidney from the last rib, which is the 12th rib. Okay, but when you come to the left side, because the left side is slightly higher than the right kidney, the diaphragm separates the kidney from the 11th rib and then the 12th rib. Now when you come below, okay, inferiorly, you can see three muscles here. Okay, more medially, we have the psoas major muscle. Okay, in the middle we have the quadratus lumborum muscle, and then this last muscle here, which is more lateral, is the transversus abdominis muscle. Okay, same thing applies here. This is the psoas major muscle, this is the quadratus lumborum muscle, this is the transversus abdominis muscle. Again, for the posterior relations of the kidney, okay, we have four muscles. There are four muscles. The diaphragm, which is above. Okay, we say the diaphragm because the right kidney is slightly lower than the left kidney. The diaphragm separates the kidney from the 12th rib. Okay, then for the lower muscles, more medially we have the psoas major. In the middle we have the quadratus lumborum muscle, and then laterally we have the transversus abdominis. Same muscle for the left side. This is the psoas major, this is the quadratus lumborum, this is the transversus abdominis muscle. Again, this is the left kidney, this is the right kidney. Okay, right is slightly lower, so the diaphragm here, the muscle above, separates the kidney from the last rib. This is the last rib, this is the 12th rib. Okay, then below we have the psoas major muscle, which is more medial. In the middle we have the quadratus lumborum muscle. Then laterally we have the transversus abdominis muscle. Okay, but for the left is slightly higher than the right, so slightly higher than the right, and so the diaphragm, which is the muscle above, separates the kidney from the 11th and then the 12th rib. Then for the muscles below, more medially, the psoas major. In the middle, we have the quadratus lumborum muscle. Then laterally, we have the transversus abdominis muscle. Okay, so we'll look at the coverings. We'll look at the layers of the kidney. Okay, there are four layers of the kidney. Okay, we call the four F's. Okay, the first F is fibrous capsule. The second F is fat. The third F is fascia, and then the fourth F is another fat. Okay, so this covering, the first one, is the fibrous capsule, very adherent to the kidney. Fibrous capsule. So that's the first F. The second F, okay, here is the perirenal fat. Okay, the perirenal fat, which covers the fibrous capsule. The perirenal fat covers the fibrous capsule. Then the third F, the renal fascia or the zuckercandle fascia. Okay, it also covers the perirenal fat. This is the third layer of covering. Okay, then the fourth one, this we have the pararenal fat. The pararenal fat. This pararenal fat, the pararenal fat actually separates the kidney from the muscles of the posterior abdominal wall. The pararenal fat separates the kidney from the muscles of the posterior abdominal wall. Again, the kidney has four layers or four coverings. Okay, we say there are four F's: fibrous capsule, perirenal fat, renal fascia, and then pararenal fat. We said the one that is most adherent to the kidney or the outermost covering is the fibrous capsule. This is it, fibrous capsule. Okay, then the second one here we have the perirenal fat, which covers the fibrous capsule. And the third one we have the renal fascia. Then we have the pararenal fat, okay, which separates the kidney from the muscles of the posterior abdominal wall. Now we'll look at the internal structure of the kidney. The internal structure of the kidney. So there are two main parts. Okay, the outer cortex. So here, this is the cortex, outer part. This is the renal cortex. See, so you can follow my cursor. Okay, this is the renal cortex, and then we have the medulla. So there's the cortex, and then there's the medulla. Okay, the cortex is made up of convoluted tubules. Convoluted tubules. When it comes to the medulla, okay, the medulla has collecting tubules. Cortex has convoluted tubules. Medulla has collecting tubules. Now you can see the apex of the medulla is called the renal papilla. The renal papilla. This is the apex of the medulla. Okay, this collecting duct would end here, the renal papilla. And then once it ends in the renal papilla, they form, or they empty into the minor calyx. So where my case is, this is the minor calyx, this is the minor calyx, this is the minor calyx, this is another minor calyx. The minor calyx will come together to form the major calyx. Okay, so this is a major calyx, this is also a major calyx. Okay, so major calyx, this is a major calyx. These major calyxes will also come together and form, okay, the renal pelvis. So this is the renal pelvis. The renal pelvis will continue as the ureter. All right. Again, this is the internal structure of the kidney. For the internal structure of the kidney, there are two main parts. We have the outer cortex and then the inner medulla. We said that the outer cortex is made up of convoluted tubules, whilst the inner medulla, okay, has collecting tubules. These collecting tubules, so these straight lines here, they are the collecting tubules. Okay, you can see that they are all converging at a particular point, which is the apex of the medulla, called the renal papilla. The renal papilla. So this renal papilla also empty into the minor calyx. So this is the minor calyx, this is the minor calyx, this is also the minor calyx, this is the minor calyx. The minor calyx will come together to form the major calyx. This is the major calyx. Okay, the major calyx also come together to form the renal pelvis. Renal pelvis continues as the ureter, right? So this is the hilum of the kidney. We said that the most anterior part is the renal vein, followed by the renal artery. Let's look at the renal artery. The renal artery. And so in anatomy, for any blood vessel, whether an artery or a vein, there are four things you need to look at. The first thing is the origin of the artery. The second thing you have to look at is the termination of the artery. The third thing you need to look at is the course of the artery. And then you look at the branches of the artery. So we are dealing with the renal artery. Okay, let's look at the renal artery. This is the abdominal aorta. This is the vena cava. Okay, so this is the renal artery. This is the right renal artery. This is the left renal artery. Okay, this is the right renal artery. This is the left renal artery. Okay, so what's the origin of the renal artery? The renal artery, okay, comes from the abdominal aorta. This is the abdominal aorta, opposite L2 vertebrae. And where does it terminate? Or how does it terminate? Okay, it divides into these arteries, these small arteries called the segmental arteries. Okay, so there are actually five segmental arteries, and this is because the kidney has 5 segments, unlike the liver that has 8 segments. Okay, so these are the 5 segmental arteries. Now, what is the cause of the renal artery? So if you look closely, you can see that this is the renal vein. Okay, this is the inferior vena cava. So the renal vein is a branch of the inferior vena cava. So if this is the renal vein, this is the renal artery. You can see that the renal artery is actually behind the renal vein. Also, the renal artery is in front of the renal pelvis. This is the renal pelvis. Okay, follow my case. This is the renal pelvis, and this is the renal artery. So it's actually in front of the renal pelvis. Then you can see that the right renal artery is longer than the left, and this is because it crosses the midline. So this is the right renal artery. It looks longer than the left. Then we look at the branches. So for the branches, we already said that for the termination, it has 5 segmental arteries. Okay, so you can see one artery here going up here. It is called the inferior suprarenal artery. Inferior suprarenal artery. So this is the left side. When you come to the right side, you can see this artery going up to the suprarenal gland, supplying the right suprarenal gland. Okay, so that's the inferior suprarenal artery. Then The artery also gives branches to the ureter, so it's called the ureteric branch. So it goes down. Okay, the artery goes down. This is the ureter. When you come here to, there's a branch going down to the ureter. Then in 15% it may give gonadal arteries. Okay, so again, for the renal arteries, we look at the origin, we look at the termination, we look at the cause, then we look at the branches. For the origin, we said it originates from the abdominal aorta opposite L2, the L2 lumbar vertebrae. Okay, it terminates as 5 segmental arteries, and we said the kidney has 5 segments, unlike the liver that has 8 segments. So 5 segmental arteries. Okay, this is the this is the left renal artery, this is the right renal artery. Okay, for the course of the artery, the renal artery is behind the renal vein and is also in front of the renal pelvis. We can see closely that the right renal artery is longer than the left. For the branches, okay, we have the inferior suprarenal artery, okay, which supplies the left suprarenal gland. Then we have here, okay, going all the way to supply the right suprarenal gland. Okay, so that's the inferior suprarenal artery. Then we have branches to the ureter called the ureteric branch, and in 15% it may give gonadal arteries. Okay, so we've looked at the renal artery, we'll look at the renal vein. But before we look at the renal vein, let's look at the blood supply to the suprarenal gland. Okay, this is the left suprarenal gland, this is the right suprarenal gland. Very, very, very important structure. Okay, so you can see these arteries here called the superior suprarenal artery. Okay, superior suprarenal artery, which is a branch of this artery here called the inferior phrenic artery. Okay, then you can see another branch here. This is the middle suprarenal artery, which is actually a branch of the abdominal aorta. And then this last artery here going from below, this is the inferior suprarenal artery, which is a branch of the renal artery. Again, the blood supply of the suprarenal gland, we have the superior ones, we have the middle one, and then the inferior one. Okay, the superior one is the superior suprarenal artery, which is a branch of the inferior phrenic artery. Then we have the middle suprarenal artery, which is a branch of the abdominal aorta. Then we have the inferior suprarenal artery, which is a branch of the renal artery. Okay, so we'll compare in terms of the renal vein, the right kidney, and then the left kidney. So you can see that, so this is the inferior vena cava, and this is the renal vein. Okay, you can see that the right renal vein is shorter than the left renal vein. Okay, and it's actually because the left renal vein crosses the aorta. So this is the aorta, this is the abdominal aorta, the right structure, it crosses it, so it's longer. It has to cross it to reach the hilum of the left kidney. The second thing is that the renal vein ends in the inferior vena cava. So this one empties into the inferior vena cava. So the right renal vein empties into the inferior vena cava. The left renal vein also empties into the inferior vena cava. Now the right renal vein has no tributaries, but the left renal vein has 2 tributaries, one above and then one below. Okay, the first one is the left suprarenal vein. Okay, this is it, the left suprarenal vein, and then it has the left gonadal vein. Okay, again, so let's compare the right and the left. We'll look at the renal veins. Okay, we said that the right renal vein is shorter than the left because the left crosses the abdominal aorta. We said that both the left and then the right renal vein empties into the inferior vena cava. The right renal vein has no tributaries, but the left renal vein has 2 tributaries, the left suprarenal vein and then also the left gonadal vein. So let's look at some kidney anomalies. Okay, this is the pelvic kidney. Okay, pelvic kidney in development, the kidney is supposed to ascend. Okay, because we said the kidney is a retroperitoneal organ, supposed to ascend to the abdomen. Okay, but when due to some reasons it does not ascend, it's called a pelvic kidney. That's an anomaly. Then we have And polycystic kidney disease, it's a genetic condition where you can have multiple cysts, containing fluids around the kidney. Usually patients do not survive beyond 60 years, tend to have renal failure. Then you can have horseshoe kidney, where the lower poles of the two kidney fuses together and refuses to separate. So you can see that the inferior mesenteric artery, this inferior mesenteric artery, prevents its ascent, is blocking its ascent. Then there are conditions where you can find a person having only one kidney. A person has only one kidney. All right. So thank you very much for your time. Kindly like, share, and subscribe to this channel, and I'll see you in the next video. Best wishes. Hello everyone. So today we'll be talking about the anatomy of the ureter. The anatomy of the ureter. We've already discussed the anatomy of the kidney. So if you haven't watched that tutorial, I will encourage you to do so. So this is going to be our objectives. We'll look at the length and the origin of the ureter. We'll look at the course of the ureter. We'll look at the posterior and then anterior relations of the ureter. The structures behind and in front of the ureter. We'll look at the arterial supply and the nerve supply of the ureter, and then we'll look at some constrictions of the ureter. Okay, so this is the ureter. Just a brief overview of the structures here. This is the right kidney, this is the left kidney, this is the right suprarenal gland, this is the left suprarenal gland. This big vessel you see here is the inferior vena cava. Then this vessel you see here is the abdominal aorta. Now this is the hilum of the kidney. This is the pelvis of the ureter. This long structure here is the ureter. That's what we are discussing today. This is the ureter. So you can follow my cursor. This is the ureter. Alright. Now regarding the length of the ureter, it's about 10 inches. So you can see 5 plus 5. It means that the ureter has two parts. It has an abdominal part and a pelvis part. We'll come to that. So bear in mind that the ureter, the length of the ureter is about 10 inches. Now the origin, it's actually a continuation of the renal pelvis. So where's the renal pelvis? This is the renal pelvis. This whole thing here is the hilum of the kidney. This is the renal pelvis. This is the renal pelvis. So it descends downwards from the ureter. Now what is the course of the ureter? The ureter has two parts. It has the abdominal part. The abdominal part actually starts from the renal pelvis here all the way to this part where we have the bifurcation of the common iliac artery. So this is the common iliac artery. You can see that it is bifurcated. So this is the internal iliac, this is the external iliac. So the abdominal part starts from the renal pelvis all the way to the bifurcation of the common iliac. Then the second part of the ureter is called the pelvic part. The pelvic part, which starts from the bifurcation of the common iliac artery to this side, which is the posterior superior angle of the urinary bladder. So let's look at the posterior relations of the ureter. This muscle here, the psoas major muscle, now the bifurcation of the common iliac is actually behind the ureter. So it's one of the posterior relations of the ureter. And also the side walls of the pelvis, the side walls of the pelvis. Again, the ureter is 10 inches in length. It's a continuation of the renal pelvis. This is the renal pelvis, a continuation of the renal pelvis. We said it has two parts. It has the abdominal part and the pelvic part. The abdominal part starts from the renal pelvis all the way to the bifurcation of the common iliac artery. Then it continues as the pelvic part, which starts from the bifurcation of the common iliac artery to the posterior superior angle of the urinary bladder. We spoke about the posterior relations of the ureter. So we have the psoas major muscle, we have the bifurcation of the common iliac artery, and then the side walls of the pelvis. So we'll look at the anterior relations of the ureter. So this is the right side, this is the left side. This is the right kidney, this is the left kidney. So when we look at the right side, this side, the anterior relations. Okay, so let's identify the kidney. This is the kidney, and this is the ureter. Okay, you see this blue structure here in front of the ureter is the renal vessels. Okay, so the renal vessels, you have the renal vein, the renal artery, the renal nerve. Okay, these are the renal vessels. They are actually anterior to the ureter. When you come to the left side, to the same thing. Okay, it's more clear here. Okay, so this is the left kidney, this is the ureter, and the vessels are anterior to the ureter. Okay, now another part is that we have the second part of the duodenum. Okay, on the right side, this is the second part of the duodenum. The second part of the duodenum is anterior to the ureter as you descend slightly. Alright, so this is the second part of the ureter. When you come to your left side, we have the body of the pancreas. So the body of the pancreas is not shown here, but the body of the pancreas lies here, somewhere here. Then this part, as we descend, this part is the third part of the duodenum, the third part of the duodenum. Okay, when we move to the left side, this is the jejunum. Okay, this is the jejunum. Right, then as we descend, for the right side, it is crossed by 4 arteries. It is crossed by 4 arteries. Okay, you have 4 arteries anterior to the ureter as we descend. Right, we have this right gonadal artery, Then we have this artery here. So please follow my cursor. This artery here is called the right colic artery. This one here is called the right colic artery. That's the number 2. The number 3, we have the ileocolic artery. There's the artery, ileocolic artery. Then the 4th one, we have the superior mesenteric artery itself, Okay, then when you come to the left side, same thing, there are 4 arteries. Okay, we have the left gonadal artery, then you have this artery called the left colic artery, then you have 2 sigmoid arteries, this one and then this one, 2 sigmoid arteries. Okay, then as you descend here, okay, after the arteries, as you descend on the right side, okay, you have the root of the mesentery, which is anterior to the ureter, the root of the mesentery here. Okay, when you come here to we have the sigmoid mesocolon. Come to the left side, we have the sigmoid mesocolon, and then this structure here is anterior to the ureter. This structure here is the terminal part of the ileum, and then when you come here, this is the sigmoid colon. Which is also anterior to the ureter. Again, we are looking at the anterior relations of the ureter. So we are looking at the left side and then the right side, the left ureter and then the right ureter. We said that for both the left and right, we have the renal vessels anterior to the ureter. Then for the right side, as we descend slightly, we have the second part of the duodenum, which is here. Then when you move to the left side, we have the body of the pancreas, which is not shown here, but this is where the body of the pancreas lies. Now, as we descend further, we have the third part of the duodenum, which is here, third part of the duodenum. And then when we come here to the left, this is the jejunum. Then on the right, it is crossed, or we have 4 arteries anterior to it. We have the right gonadal artery, we have the right colic artery, we have the ileocolic artery, then we have the superior mesenteric artery. Okay, when we come to the left side, there are also 4 arteries. The left gonadal artery. Okay, then we have the left colic artery. Then we have 2 sigmoid arteries here and then here. Okay, as we descend further, on the right we have the root of the mesentery, and then on the left we have the sigmoid mesocolon. As we descend further, this structure here, this one here, is called the terminal part of the ileum, and then this structure here, which is anterior to the ureter, is the sigmoid colon. So look at the arterial supply of the ureter, okay. So the ureter is supplied by 7 arteries: the renal artery, the gonadal artery, the abdominal aorta, common iliac artery, internal iliac artery, inferior vesical artery, uterine artery. So you have branches coming from these arteries supplying the ureter. Okay, so this is the right kidney, this is the left kidney. Okay, so what we have here is the ureter, So you can see this is the renal artery. There's a branch coming from the renal artery to supply the ureter. This is the renal artery. There's a branch coming from the renal artery to supply the ureter. Okay. Then this is the gonadal artery. So you can see there's a branch from, so see, this is the gonadal artery. There's a branch from the gonadal artery supplying the ureter as we descend, right? Then we have the abdominal aorta itself, the abdominal aorta. You can see a branch from the abdominal aorta also giving arterial supply to the ureter. Then there's the common iliac artery. You can see there's a branch from the common iliac artery also going to supply the ureter. Then we have the inferior vesical artery. Okay. Then we also have the uterine artery. So the inferior vesical artery is also called the uterine artery. Okay. Then the internal iliac. See, this is the common iliac artery, which bifurcates into the internal iliac artery and then the external iliac artery. Okay. For the internal iliac artery, it also gives off a branch that supplies the ureter. Again, the arterial supply of the ureter. There are branches from these seven arteries, that supplies the ureter. Okay, the first one is the renal artery. This is the renal artery. Okay, you can see the branch here, branch from the renal artery supplying the ureter, branch from the renal artery supplying the ureter. Then we can see this is the gonadal artery. There's a branch from the gonadal artery supplying the ureter. Then there's the abdominal aorta. Okay, there's a branch from the abdominal aorta supplying the ureter as you move downwards. Then there's the common iliac. There's also another branch from the common iliac giving arterial supply to the ureter. Then the internal iliac artery, okay, which is formed after the bifurcation of the common iliac, also gives a branch to supply the ureter. Okay, then we have the inferior vesical or the uterine artery. So for the nerve supply, we have the sympathetic and the parasympathetic nerve supply. For the sympathetic nerve supply, we have the splanchnic nerve T12 and L1 splanchnic nerve. Okay, so when we say splanchnic usually has to do with the viscera, okay, structures, the organs within the abdominal cavity. Okay, so splanchnic nerves are nerves that supply the visceral organs. Okay, so sympathetic outflow is by the splanchnic nerve T12 and then L1. Then for parasympathetic, we have the pelvic splanchnic nerves S2, S3, and then S4. Now we need to understand the concept of referred pain when we are talking about the anatomy of the ureter. We need to understand the concept of referred pain. Now, when we say referred pain, pain that is perceived at a location other than the site of the painful stimulus. So there's a site for the painful stimulus, however the pain is perceived in a distant soma. So for you to understand the concept of referred pain, you need to understand dermatomal room. What is a dermatome? A dermatome is an area of the skin that is supplied by a single dorsal nerve root. Okay, so when pain is referred, it is usually to a structure that developed from the same embryonic segment, or dermatome as a structure in which the pain originates. Again, when pain is referred, it is usually to a structure that developed from the same embryonic segment, or dermatome as the structure in which the pain originates. Okay, so because we said in the previous slide that for the nerve supply of the ureter, we have the sympathetic and then the parasympathetic. Okay, sympathetic is T12 and then L1. Parasympathetic is S2, S3, S4. Okay, so if there's, for instance, if there's a stone within the ureter, okay, the pain would radiate along a dermatome. Okay, so usually this anterior abdominal wall, the lumbar region. Okay, this is the lumbar region, anterior abdominal wall, and also around the perineum. The perineum is supplied by S2, S3, S4. So even though the ureter is here, if there's a stone here that is causing an obstruction, or a stone that is supposed to cause pain, the pain will radiate along this dermatome. Okay, T12, this dermatome, this is the L1 dermatome. This is the L1 dermatome. This is the T12 dermatome. Okay, this S1, S2, S3. Around the perineum is S1, S2, S3. All right. Now, what is the lymph drainage of the ureter? Lymphatic drainage of the ureter. The upper part of the ureter drains into the para-aortic lymph nodes. So these are the para-aortic lymph nodes. Now, the middle part, okay, where we have the bifurcation of the common iliac, okay, drains into the common iliac lymph nodes. Common iliac lymph nodes. Then the lower part of the ureter, okay, drains into the internal iliac lymph nodes. Again, for the lymphatic drainage, okay, the upper part drains into the para-aortic lymph nodes, which is here. The middle part drains into the common iliac lymph nodes, and then the lower part drains into the internal iliac lymph nodes. Okay, so you can actually tell the lymph nodes by the location. Okay, yeah, this structure is actually the abdominal aorta. Okay, so you can use that to remember para-aortic lymph nodes. Okay, here is where we have the bifurcation of the common iliac. This is the common iliac. Okay, so you can say common iliac lymph nodes. Then once it bifurcates, this is the internal iliac. So you can say internal iliac lymph nodes. Now, what are the constrictions of the ureter? There are three constrictions of the ureter. There are three constrictions of the ureter. The first one is at the pelvic-ureteric junction. This is the first constriction at the pelvic-ureteric junction. The second constriction is at the bifurcation of the common iliac artery. So this is the common iliac artery. Around this region, there's a constriction here. Okay, here. The first one is here, pelvic-ureteric junction. The second one is here. Okay, at the bifurcation of the common iliac artery. Then for the third one, we have the intramural. Okay, the part that is entering into, okay, so intramural part that is really entering into the bladder. All right. Now, what is the significance or clinical importance of this constrictions? Knowing the constrictions or the sites, constricted sites of the ureter. Okay. Now these sites are the commonest sites where you can have an arrest of a stone, usually called a kidney stone. It is this stone that can cause a referred pain, usually what we call a ureteric colic. Okay. Now this is an IVP, this is an intravenous pyelogram. Okay. If you want to really identify or trace the ureter, okay, these are the minor calyx, this is the major calyx, this is the pelvis, renal pelvis. Okay, so this structure coming down is a ureter. Structure coming down is a ureter. Okay, so usually the ureter descends on the tips of the lumbar transverse processes. Okay, so these are the lumbar transverse processes. Then it appears behind, okay, in front of the sacroiliac joint, and then goes to the ischial spine. Okay, so this is a plain X-ray. This is actually a plain X-ray. This is an IVP. Okay, so this is how to identify the ureter. So if you want to know the constrictions that we spoke about, we said the first one is at the pelvic-ureteric junction around the side. Then around the side where you have the bifurcation of the common iliac, that's the second site, and then the intramural site as it enters the bladder. Okay, so if you learned a thing or two from this video, kindly share, like, and subscribe to my channel, and kindly leave a comment. I'll see you in the next video. Best wishes.